Welcome to the intensive care case. Our patient needs a central venous catheter for long-term administration of medication. This procedure can be safely performed under ultrasound guidance.
Since this is an invasive intervention, we cannot perform this on a healthy volunteer. Therefore, we use this mannequin with simulated arteries and veins. Dr. Hom shows where he expects the jugular vein to be in the mannequin. This expectation is based on landmarks of a large neck muscle, the sternocleidomastoid muscle, and the clavicular bone. In this triangle formed, we should look for the jugular vein. The first question that pops up is which probe is the best for this purpose. In this case, we have a linear probe with a frequency of 5 to 14 MHz and a curved probe with a frequency of 2 to 6 MHz. The main structures that we are interested in are the vein, which is about 2 cm beneath the skin, and the needle that we insert. Do you know which probe would suit our needs the best? Our second question is how we should place our probe on the mannequin. Dr. Hom points at the jugular vein, which runs in the direction from head to toe. This is also the catheter insertion direction. Should we place the probe in the same direction as the blood vessel or perpendicular to the vessel? Think about it.
We have shown you that ultrasound plays a supporting role in this procedure. We would like you to think about the most appropriate choices applying ultrasound to assist us in this procedure.